Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling increasingly out of breath these past months, and my legs are swelling up more than usual. I've had to go back to using more Lasix because when I tried reducing it, things just got worse. I'm really concerned because it feels like my heart isn't handling things well.
I understand your concerns. Let's go over everything in detail so we can address each issue properly. You mentioned increasing the Lasix on your own. Can you tell me more about that and how your symptoms changed when you adjusted the dosage?
Well, after my last visit to the cardiologist, I was advised to lower the Lasix because of potential side effects. But my swelling didn't improve and the breathlessness increased. I felt so uncomfortable that I went back to my usual dose after just a week. But even with that, I'm still struggling.
It's important to follow the prescribed dosages, but I understand that you were trying to manage worsening symptoms. You also mentioned concerns about your blood pressure and kidney function. Have there been any new symptoms affecting your daily activities?
Yes, the neuropathy in my legs has been causing quite a bit of pain, making it difficult to walk or stand for long periods. This, combined with my breathing issues, really limits what I can do around the house or at work. It's very frustrating.
I see. And how about your management of diabetes and your diet? How have those been going?
Managing my diabetes has been quite challenging. My blood sugar levels have been fluctuating a lot more. I think it's partly due to the stress from work and all these health issues. I try to stick to a diabetic diet, but it's been hard with everything going on.
Stress can definitely impact your blood sugar levels and overall health. We'll keep that in mind as we plan your care. Now, let's discuss the lab test and recent echocardiogram. Your latest tests show an ejection fraction of 35%, indicating some deterioration in heart function. Your lab results also show low magnesium and potassium, which are likely linked to the increased use of Lasix.
I was afraid of that. The cardiologist mentioned something about the ejection fraction last time. It's a lot to take in.
I understand it's overwhelming, but we're going to tackle this together. Based on what you've told me and your recent lab results, we need to adjust your treatment plan slightly. Your hemoglobin A1C is at 8.4%, which is higher than our target, and this could be contributing to your symptoms. Your kidney function tests show a decreased eGFR of 59 millils per mins per 1.73 mils, which, while not critical, is something we need to keep an eye on, especially with your use of medications like Lasix.
So what's the next step, doctor?
Here's what we'll do. First, we need to adjust your Lasix to better manage your fluid retention without further impacting your kidney function. I'll also refer you back to cardiology for a follow-up echocardiogram to reassess your heart function more accurately. We might consider reintroducing niacin to manage your cholesterol levels, as your LDL and triglycerides are also higher than we'd like.
And my diabetes.
For your diabetes, I'm going to refer you to an endocrinologist to optimize your management. It's crucial we get better control to help alleviate some of your symptoms. We'll also schedule you for regular lab tests to monitor your kidney function and electrolyte levels more closely. I'll prescribe new supplements to manage your low magnesium and potassium levels, which you should start as soon as possible.
Sounds like a comprehensive plan. Thank you for laying it all out.
Absolutely. It's important that you feel supported through this. We'll monitor your symptoms closely and adjust as needed. Make sure to pick up your new supplements immediately and keep a close eye on your fluid retention and breathing. We'll have regular follow-ups to reassess everything and ensure your medications are working effectively. Your health and comfort are our top priority.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, the last few months have been particularly tough. I've been dealing with this back and hip pain that just seems to get worse, especially when I'm walking. It radiates down to my knees, and at night, it's just unbearable. I've been on Vicodin off and on, but I'm really worried about the effects it might have on my liver, and I don't want to become dependent on it. I've tried Flexeril at night, and it does help a bit with the pain so I can sleep, but it's not a long-term solution.
I understand your concerns about the pain medication. It's good that you're cautious about long-term use. Tell me more about the interventions you've tried so far for your back pain.
Well, I had some physical therapy sessions a while back, and they helped for a little while, but the pain just keeps coming back. It feels like nothing gives permanent relief. Between the arthritis in my hands and my back issues, it's just a lot to manage.
It sounds like it's been quite challenging for you. How about your daily activities? How is this affecting your mobility and daily life?
It's affecting everything, really. I have trouble walking for more than a few minutes without severe pain. It's also been affecting my sleep because I have to get up multiple times at night to use the bathroom, which my doctor said might be due to an enlarged prostate. My hearing has also gotten worse, and I think I might need hearing aids.
That must be very difficult, especially with your mobility issues. Have you noticed any changes in your vision as well?
Yes, my vision isn't what it used to be. I've always worn glasses for nearsightedness, but I feel like my vision has gotten worse lately. I haven't gone for a checkup in a while.
Thank you for sharing all of this. It helps me understand the full scope of what you're dealing with. Let's go over some of your recent test results and see where we can go from here.
Please, I just want to find a way to manage this better.
Of course. Let's start with your lab results. Your complete blood count looks stable, which is good. Your hemoglobin is at 13.8 grams per deciliter, which is within normal limits, and your white blood cell count and platelets are also normal. Your basic metabolic panel shows normal kidney function with a creatinine of 1.1 milligrams per deciliter and normal electrolyte levels. Your liver function tests are reassuring as well, with ALT and AST levels within the normal range, which is good considering your concerns about Vicodin.
That's a relief to hear at least.
In terms of imaging, the X-ray of your lumbar spine shows mild to moderate degenerative changes, but no acute fractures. There is a slight scoliotic curve, but no significant displacement. Given your symptoms and these results, we should consider an MRI to get a clearer picture of your spine and hips, especially to assess for any nerve impingement that might be contributing to your pain.
What are the next steps then?
Here's what I recommend. First, we'll schedule an MRI to investigate further into the causes of your sciatic pain and check for any other potential issues in your spine. Second, I'll refer you to a pain specialist who can offer more targeted pain management strategies. We should also consider updating your hearing and vision tests to address your sensory impairments. Finally, continuing with a gentle physical therapy regimen might be beneficial to help manage your pain and improve mobility without excessive strain.
Thank you, Doctor. I hope this plan will help me manage the pain better and improve my quality of life.
That's our goal. We'll work together to find the best strategies to manage your symptoms and improve your overall health. I'll have my team schedule the MRI and the specialist appointments, and we'll follow up after those consultations to adjust our approach as needed.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We must acknowledge the inherent biases in healthcare AI algorithms. These are often trained on data that doesn't adequately represent diverse populations, leading to skewed results.
I agree, but it's also essential to consider the benefits. AI can handle vast amounts of data more efficiently than humans. The key is improving data collection and algorithm training processes.
Exactly. But until we have a standardized way of addressing these biases, we risk perpetuating disparities in healthcare outcomes. This includes not only racial and ethnic disparities, but also socioeconomic ones.
To mitigate this, perhaps we need to implement more rigorous oversight and testing. Also, involving multidisciplinary teams in the development phase might help us better identify and correct biases early on.
That's a viable solution. Additionally, educating healthcare providers on the limitations of these tools is crucial so they can use AI recommendations judiciously.
Absolutely. It's about finding the right balance between leveraging technology and maintaining ethical standards to truly benefit all patient demographics.
Now look at question 26.
Chronic fatigue syndrome, or CFS, is characterized by extreme fatigue that doesn't improve with rest and can worsen with physical or mental activity. It's not just about being tired. It's a complex condition that can severely impact your daily life.
I see. How is it diagnosed?
Diagnosis can be challenging as there's no specific test for CFS. It's mostly diagnosed based on your symptoms and by ruling out other possible causes of fatigue. That's why detailing all your symptoms is crucial for accurate diagnosis.
And what about managing the condition?
Management focuses on pacing your activities to avoid overexertion, conserving energy, and managing stress. It's important to listen to your body and adjust activities to your energy levels. We may also explore treatment options like cognitive behavioral therapy to help manage symptoms.
Now look at question 27.
The treatment can cause several side effects, including fatigue, skin rashes, and flu-like symptoms. These are common but manageable.
Fatigue has been really challenging for me. How can I cope better?
It's important to prioritize rest and conserve your energy. Also, mild exercise, like short walks, can sometimes help improve energy levels over time. For skin rashes, moisturizing creams can be effective, and we can prescribe medications if they are severe.
What about the flu-like symptoms?
For those, hydration and over-the-counter pain relievers can help. Always inform us about your symptoms, as we might adjust your treatment based on your experiences.
Now look at question 28.
Rural communities often face significant challenges due to lower health literacy rates. This can lead to poorer health outcomes because residents might not understand medical advice or recognize early symptoms of diseases.
Absolutely, and the lack of nearby healthcare facilities doesn't help either. It's crucial to implement educational programs tailored to these communities.
Exactly. We need to find ways to deliver clear, understandable health information and possibly leverage technology like telehealth to bridge these gaps.
Education is key. Maybe integrating health education into the local schools and community centers could help improve literacy from a younger age.
Now look at question 29.
I understand this news can be very overwhelming. Your spouse has been diagnosed with Alzheimer's disease, which affects memory and cognitive functions.
How do we manage this going forward?
It's important to focus on what we can do to support your spouse. There are medications that can help manage symptoms and slow progression. Additionally, joining a support group can be beneficial for both you and your spouse.
Thank you for your support and for explaining things gently. What else should we consider?
Consider legal and financial planning for the future. It's also crucial to ensure a safe home environment as the condition progresses.
Now look at question 30.
Let's discuss the community resources available for our patient who is recovering from stroke. He'll need ongoing rehabilitation and support.
There's a community center nearby that offers physical therapy and speech therapy sessions. Perhaps we could collaborate with them.
That sounds good. Also, there's a local support group for stroke survivors. It could be beneficial for his mental health to connect with others experiencing similar challenges.
I agree. Let's also consider transportation options, as he might have difficulty getting around. Maybe we can arrange for community transport services to assist. It is crucial for enabling access to necessary rehabilitation and support services.
Excellent points. I'll compile a list of these resources and start making the necessary contacts.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Good morning, everyone. Today, we will delve into the complex issue of vaccine hesitancy, particularly focusing on pediatric vaccinations. Our discussion will integrate insights from a recent Harvard study exploring the socio-psychological factors contributing to this phenomenon. The aim is to enhance our understanding of how to address and mitigate vaccine hesitancy effectively.
Thank you for the introduction. As we dive into this topic, it's critical to first understand the landscape of pediatric vaccination hesitancy. Research indicates that concerns about vaccine safety and efficacy are the predominant factors fueling hesitancy among parents. A case in point is the story of Emily, a 5-year-old whose parents delayed her vaccination due to fears about potential side effects.
That's an important example. Could you elaborate on the specifics of Emily's case and how it reflects broader trends?
Certainly. Emily's parents were influenced by misinformation spread via social media, highlighting severe but extremely rare vaccine side effects. This fear was compounded by a lack of trust in the healthcare system, which is often seen in communities where historical medical practices were questionable Emily's case is reflective of a significant portion of the population that remains skeptical despite the overwhelming scientific evidence supporting vaccine safety and efficacy.
That brings us to the crucial role of communication in combating vaccine hesitancy. The Harvard study suggests that personalized communication from trusted healthcare providers is key. How can we apply this in practice?
Effective communication strategies involve several layers. First, healthcare providers must be equipped with the latest data and training to address common misconceptions about vaccines. Secondly, the approach should be empathetic. Understanding the parent's concerns without judgment can help in building trust. For example, in Emily's case, her pediatrician spent time explaining the vaccine development process and the rigorous safety protocols involved, which gradually alleviated her parents' fears.
It sounds like trust is a central theme here. Besides direct communication, are there other strategies that healthcare systems can implement to build this trust?
Absolutely. Community engagement is vital. Healthcare systems should collaborate with community leaders and influencers who can act as vaccine advocates. These leaders often hold the cultural and social capital to sway public opinions positively. Additionally, organizing community forums where parents can openly discuss their concerns with experts and hear from other parents can also be beneficial.
Let's talk about the potential barriers to implementing these strategies. What are some challenges that healthcare providers might face?
One major barrier is resource allocation. Implementing widespread educational campaigns and training healthcare providers requires significant funding and time. Another challenge is the digital divide. In many underserved communities, access to reliable and scientifically accurate information might be limited, which hinders effective communication.
Considering these challenges, what are some actionable steps that healthcare organizations can take to improve vaccine uptake among children?
Healthcare organizations should prioritize funding for community-based outreach programs and invest in training for healthcare providers to improve communication skills. Additionally, partnerships with technology companies could help bridge the digital divide by providing platforms for disseminating accurate information and facilitating virtual healthcare interactions.
As we wrap up our discussion, it's clear that tackling vaccine hesitancy requires a multifaceted approach, combining direct communication, community engagement, and strategic use of technology. Emily's case is just one of many, but it highlights the potential to change perceptions and improve health outcomes through informed and compassionate practices.
Indeed, the journey to overcoming vaccine hesitancy is ongoing. It requires persistence, empathy, and innovative strategies to ensure that all children, like Emily, have the opportunity to be protected against preventable diseases. Thank you for the engaging discussion today.
Thank you, everyone, for joining us. Let's continue to work together to promote public health and combat vaccine hesitancy effectively.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we're delving into two critical advancements in neuro-ophthalmology that have the potential to significantly alter clinical practices and patient outcomes in MOG, antibody-associated disease, MOGAD, and idiopathic intracranial hypertension, IIH. Recent scholarly work, particularly articles published in The Lancet Neurology and Brain, provides us with new insights into diagnostic criteria and innovative treatment approaches. Let's begin with MOGAD, a distinct demyelinating disorder identified by the presence of myelin oligodendrocyte glycoprotein MOG antibodies, which can lead to conditions like optic neuritis, transverse myelitis, and cortical encephalitis. A landmark study in The Lancet Neurology proposed new international criteria for diagnosing MOGAD, which emphasizes the importance of antibody titers in diagnosis. High titers of MOG antibodies significantly correlate with MOGAD, whereas lower titers may require additional clinical evidence due to the risk of false positives. This nuanced approach ensures a more accurate diagnosis, guiding targeted treatments that differ significantly from those for similar conditions like multiple sclerosis, MS, or neuromyelitis optica, NMO. Consider the case of a 34-year-old patient presenting with bilateral optic neuritis and a high titer of MOG antibodies. Under the new criteria, this patient was promptly diagnosed with MOGAD. Treatment commenced with high-dose corticosteroids, followed by plasma exchange, leading to significant recovery of vision. This case highlights the necessity of understanding and implementing the new diagnostic criteria to prevent misdiagnosis and ensure effective management. Moving to idiopathic intracranial hypertension, a recent randomized clinical trial published in Brain has put the spotlight on the use of exenatide, a GLP-1 receptor agonist for managing IIH. This study is revolutionary as it suggests that exenatide not only facilitates weight loss, which is a crucial aspect of IIH management due to its association with obesity, but it may also have a direct effect in reducing intracranial pressure. Patients treated with exenatide showed a significant decrease in intracranial pressure within hours, an effect that persisted over the course of the study. These findings are profound. Traditionally, treatments like acetazolamide and topiramate were the mainstay for IIH due to their ability to reduce cerebrospinal fluid production. However, their side effects often limit usability. Exenatide, by contrast, offers a promising alternative with potentially fewer side effects and dual benefits of weight loss and direct reduction of intracranial pressure. Implementing this treatment could dramatically change the management landscape for IIH, offering new hope to patients suffering from this debilitating condition. The advancements in diagnosing and treating MOGAD and IIH represent significant strides in neuro-ophthalmology. For clinicians, staying abreast of these developments is crucial for improving patient care and outcomes. As research progresses, we anticipate more sophisticated diagnostic tools and treatments that will continue to enhance our ability to manage these complex diseases effectively.